Good afternoon, this is Ed Crow. Today we're going to talk about Medicaid and drug help programs. I'll wait another minute or so we can get started. All right, so I have about 1 o'clock. Let's see, we'll wait for a couple more people to come on here and then we'll get going. All right, so I think I'll get us started. So just a few things. So today we're going to talk about Medicaid and drug help programs. And I'll mix in a little how they work with Medicare Advantage PDPs and supplements as well. I get that question a lot. I do record these webinars. If you haven't been on these before, anybody who registers will get a copy of the recording. So for future reference, we do these webinars on Wednesdays and Thursdays at 1 o'clock. If you want to come on to a future webinar or watch it, but you're not available at that time, you just simply need to register. If you register for it, you'll get the recording automatically. Tomorrow, for example, we're going over our Discount RX program. It's been made to compete with GoodRx, but it actually pays agents when people use it, which is unique. And we're going to talk about that tomorrow, for example. So every Wednesday and Thursday at 1. The other thing is why we go through, unfortunately, I'm not smart enough to answer questions as I do the webinar. So if you have questions, just send them into the question box and I'll answer them for you or try to answer them for you at the end. Other than that, let's get started. So today we'll talk about Medicaid and drug help levels. Try to explain the difference between Medicare Savings Program and Medicaid. It gets confusing, I know, but try to just give you a basic understanding of that. Talk about QMB plus in Medicaid versus QMB only, and then balance billing for QMB and Medicaid. And then I'll try to tie that in with how they work with Medicare Advantage, so standard Medicare Advantage plans, dual advantage PDPs and supplements. So let's talk first about Medicare Savings Program versus full Medicaid. MSP is used to describe the levels of help below full Medicaid. So a lot of times people will confuse that. So you have full Medicaid. So that's somebody who is the highest qualifier. They've got the lowest income. Usually there's an asset test. You have full Medicaid. Then you have the Medicare Savings Program, which are levels below Medicaid, and that includes QMB, SlimB, QI, and ALMB. And I'll talk about all 4 levels. What gets confusing sometimes is Medicaid is also sometimes referred to QMB plus, but that's not the same as a regular QMB. So I'm going to explain the difference there. So these programs provide coverage for the cost share on Medicare approved benefits for medical and drug. So not all of them do. Just to give you a quick summary, full Medicaid will provide cost share for medical and drugs. And QMB, part of the Medicare Savings Program, will also cover medical and drugs. The other levels, SLMB, QI, and ALMB, they'll cover drugs only. So they help with benefits, but they don't cover medical benefits. Anyway, these programs are funded by the government. They're administered by the state. But that's why, because they're administered by the state, they all do get partial government funding, but because the states administer them, you'll see the income qualifications for each will be different. And for example, some states don't even offer the ALMB level. Okay, so we'll talk about Medicare Savings Program. I'll refer to that as MSP versus full Medicaid. So first of all, Medicare Savings Program, a few differences is full Medicaid will cover some benefits that aren't covered by original Medicare. So if somebody's a full Medicaid recipient, they will get coverage for things like vision, dental, transportation, all sorts of extra benefits that they get on full Medicaid. The MSP programs will not do that. So if somebody's a QMB, that's the highest level of MSP, they'll get coverage for medical and drug, but they don't get extra benefits. And that's something that people don't often remember. So you'll get somebody who's on maybe an Advantage plan or is looking at a dual and they're a QMB, and you're thinking to yourself, well, they've got all their copays covered and their drugs are covered at a high level anyway. But keep in mind, a QMB does not get the extra benefits that a full Medicaid does. So a QMB, definitely dual plans will look very attractive to them because they're not getting vision, dental, non-skilled home care, transportation, things such as that a full Medicaid person gets. So let's talk about the levels of Medicaid and Medicare savings program. So again, full Medicaid is listed as Medicaid, or sometimes they'll call it QMB Plus. For the Medicare savings program, the programs that fall under that are QMB, SLMB, QI, and ALMB. And note that the ALMB level, which those are people with the highest incomes allowable to be on any level, is ALMB. So it provides the least benefits, and you can have the highest income to ALMB. That's not available in a number of states. I'm in Connecticut, for example. They have ALMB in Connecticut, and the income, an individual in Connecticut can make $2,500. A couple can make up to about $3,500 and still get the ALMB level, but it's not in every state. Okay, so whether somebody is on Medicaid or they're on Medicare savings program, let me rephrase that. Anybody on Medicare savings program, you'll hear the term extra help thrown around, or LIS. Any level of Medicare savings program, MSP, that's the QMB through the ALMB, they all automatically qualify for extra help. So extra help is going to cover and give them help on their drugs. So any level gets extra help at a minimum. So when you hear extra help or LIS thrown around, that's because they qualified for it through one of the Medicare savings program levels. And extra help covers the drug premium for standalone PDP plans, and it covers the drug premium portion of an MAPD plan. But they'll only cover it up to the state benchmark in each state. So each state has a different benchmark, by the way. So, you know, one state might have a benchmark premium of $25. So meaning if somebody's on any level of Medicare savings program and they have a standalone PDP, Medicare savings program will only cover up to $25 a month of that premium. Versus another state might have a $43 benchmark. So in that state, MSP, Medicare savings program, will cover up to $43 of a PDP or MAPD. This gets a little tricky on MAPDs. Let's use an example. Let's say you have an MAPD that is a $50 premium. Well, that insurance company has assigned some of that premium is medical premium and some of it is drug premium. Whatever portion's been assigned as drug premium will be covered by the enrollee in Medicare savings program. So maybe in my example, $20 of that plan is medical and $30 is drugs. So MSP will cover $30 towards that Medicare Advantage plan's premium, but it won't cover the $20 that's affiliated is the medical premium of the plan. Regardless, any level of Medicare savings program will put caps on prescriptions, and the caps are $3.70 on generic, $9.20 on brand name medications. If somebody is full Medicaid, obviously these caps are much lower, but in the Medicare savings program, those are the caps. And these caps are applicable even in the donut hole, by the way. So if you're in the donut hole, it doesn't matter if you have Medicare savings program, because you're going to pay no more than $3.70 for a generic and $9.20 for a brand drug. So Xarelto, for example, will be $9.20, and there will be no donut hole. There's also no deductible either. So I should have said that. It's $9.20 cap even in the deductible phase. And also all levels of Medicare savings program, even the ALMB level, all levels, so all levels cover drugs and all levels cover your Part B premiums. So if somebody has Medicare savings program, they're not paying their Part B premium. Even if they have a penalty, the penalty gets paid as well. And I didn't put it on here, I don't think, but the same thing goes for if you have a Part D penalty, it'll pay that as well, but only up to the benchmark for your state. Okay, so now let's talk about QMB and QMB Plus. So keep in mind, QMB Plus is considered, that term is used for Medicaid often. So we're going to talk about QMB because QMB is part of the Medicare savings program. It's not Medicaid, technically, it's MSP. So if somebody's a QMB, they get more benefits than the levels below QMB. So all the levels get drug help, Part B premium, Part D premium help, but a QMB also gets copay help. So somebody's a QMB, it'll pay for their Medicare Part A, even if they don't have free Part A, and it'll pay their Part B premiums just like the other levels will. It'll pay any A and B late enrollment penalties. It'll pay drug premium up to the benchmark. So again, same as with the other levels of Medicare Savings Program. The difference though is at a QMB level, it'll cover the cost share that Medicare doesn't cover. That's whether they're on original Medicare, the QMB will pick up what's left over, or if they're on a Medicare Advantage plan, and they can even be on a regular Advantage plan. People often think that if you're full dual or a QMB and you need to go on a dual plan to not have any copays, and that's not the case. You can put a full dual or QMB on a regular Advantage plan, and let's say that Advantage plan says, okay, $45 for a specialist copay. If they're full dual or QMB, the state's going to pay, the full dual or QMB is going to pay that $45. They won't pay it. Same thing with hospital deductibles. Any medical cost share of that plan will be covered at the full dual or QMB level. So your Medicare Advantage enrollees won't pay any of the copays or cost share listed. So when you're looking at people with QMB or full dual, if there happens to be, it's rare, but if there happens to be a regular Advantage plan that has better ancillary benefits than the dual plans in your market, go ahead and enroll them in a regular Advantage plan. There's not a problem, it will coordinate. And I see we have a couple questions, and I'm just, for those who just came on, I'm going to answer those for you at the end. And we'll only run this, I should mention, this webinar will only run about 20 minutes. Okay, so one thing with a full dual or a QMB, the program will cover cost share as long as the benefits would be otherwise be covered by the Medicare Advantage plan. So for an example, somebody's a QMB, you put them in an Advantage plan, they go to an in-network doctor, remember on Advantage, Medicare's primary, whatever copays left over the QMB will cover. But let's say you enroll somebody in a HMO Advantage plan, whether it be a regular one or a dual. They go to the doctor and that doctor isn't in network. Well, be careful because then the QMB isn't going to help either. So if that doctor, it's really important to check your doctors on Advantage plans when somebody's got QMB, because if their Medicare Savings Program QMB, that doctor's out of network, the QMB's not going to cover it. And the same goes for medications. Let's say somebody's any level of Medicare Savings Program for that matter, and they're getting help with their drugs, but you put them in an Advantage plan or a PDP, and one of the drugs they take is not in the formulary of the plan, well, the state's not going to help then either. So they're just not going to have any coverage for that drug in that case. So you got definitely important with QMBs to check or any level of Medicare Savings Program for that matter, but it's definitely important to check the doctor network, make sure the doctors are in network, and it's definitely very important to make sure that the drugs are in the formulary of the plan you're choosing for. Okay, so obviously I mentioned other levels. The SlimB and ALMB level, same thing, like all levels of Medicare Savings Program, covers drugs, covers your Part B premium and penalties, covers the drug plan premium, except at these levels there is no help for medical expense. Doesn't cover copays on an Advantage plan. Most of these levels have income and asset limits. Keep in mind that some states allow for higher limits than others. States that have the ALMB level, there are states like Connecticut, for example, which, like I said, you can go up as high as, there's no asset test in some states in ALMB. And for example, in Connecticut, there's no asset test, and an individual can make up to $2,600, and a couple can make $3,500 and still be eligible. Some states do have asset limits on all levels, so it just depends on your state. Like Florida, for example, they have asset limits on all of these levels, whereas like Connecticut or Michigan does not have an asset test on their ALMB level. It just depends on the state you're in. And then on top of that, further, some states have additional programs not affiliated with this at all, called pharmaceutical assistance programs, SPAPs. And an example of that would be like Epic in New York, where you can have a much higher income level. Couples on Epic can make up to $100,000 and still get drug help through Epic. But again, Epic's a separate program unique to New York. It has nothing to do with Medicaid or Medicare savings program. So let's look at the national asset and income levels for Medicare savings program. As you can see, the QMB levels, so those are income levels, and there's resource, meaning asset limitations as well for QMB, SLIMB, QI, and QDWI. That's the national level. A lot of states have adopted this, so you can't make that much money. However, there are some states that have decided to make these levels much higher, again, like Connecticut, for example. And in addition to that, some states add the ALMB level to this, which still helps with drug premiums, still pays your Part B premium, still limits your copays on drugs, and you can have much higher income limits. And there is no resource test in some states on these levels, but most have it. Something that comes up quite often is, what if you put somebody in a Medicare Advantage plan and they're a QMB and they go to a doctor, so the QMB is going to make it so they have no copay and the doctor's in network on the Advantage plan, but what if you go to that, they go to that doctor and the doctor says, well, we don't participate with the state. And that doctor says, you have to pay your copay. Well, as you can see here, and I'll leave it on this slide for a minute, that's not allowed. So doctors will certainly try. If they don't accept state, they get somebody who's a QMB, they'll try to charge them a copay. They're legally not allowed to. So if the patient pushes back on that, the doctor's office will pretty quickly say, yeah, you're right, we can't bill you anything. They do have the option, however, of saying, and we don't want to see you anymore. So that's something to be aware of. Most won't do that, but some do. So just to read it, federal law prohibits Medicare providers and suppliers, including pharmacies, from billing people in the QMB program for Medicare cost sharing. So Medicare beneficiaries enrolled in the QMB program have no legal obligation to pay Medicare Part A or B deductibles, coinsurance, or copays. In other words, you go to a doctor, you're a QMB on an Advantage plan, doctor's in the network of the Advantage plan. Doctor says, great, we're in this Advantage plan, we don't take state, you're gonna have to pay the copay. They can't do it, in other words. Exception to that is if you go to the doctor and they're not in network of the Advantage plan, and that's an HMO Advantage plan, well, then nothing's gonna be covered. Just so you're aware, because that happens often. Okay, so anybody that has any level of Medicaid or Medicare savings program, or even state pharmaceutical assistance like Epic, they have a special election for that. And what they get is a special election that can be used one time each quarter, but it's only for the first 3 quarters of the year. And that election could be used for anybody who's on the program, they get 1 election per quarter. So it's per quarter, and it can be the first of the next month, anytime during that quarter. But it's only 1 per quarter. So if they're on the program, they get a special election. If they're coming on to one of these programs, they get a special election. Or if they're going off, they get a special election. And just remember, if they're in the 4th quarter, they're not going to have a special election. They're going to have to use the AEP for a January 1 effective. So this applies, the special election applies to any Medicare Advantage, dual or non-dual plan, and standalone PDP plans. Rules regarding QMBs. So if you got a Medicaid person, a QMB plus, which remember QMB plus and Medicaid are interchangeable terms, you are not supposed to enroll a Medicaid or QMB plus in a supplement. So be careful with that. You can, however, remember, QMB is through the Medicare Savings Program. You can enroll, although you won't do it that often, you can enroll a member with QMB into a supplement. Usually you wouldn't want to do that because QMBs aren't paying cost share, medical cost share anyway, so really why would you put them in a supplement? There's not that many reasons why you would, but you can do it if you'd like. QMBs also get help, QMBs, ALMBs also get help with standalone prescription drug plans up to the benchmark premium, and it listed there, I'd mentioned benchmark premium before, and I listed the range on the benchmark premium, depends on state, and it ranges from 22 max to 47 depending on the state you're in. And that simply means that's how much they will cover towards the cost of a standalone drug plan or the drug portion of premium of an Advantage plan. So important takeaways on this. QMB Pluses, Medicaid, and QMBs will, I should say right there, will not. That threw me off. So I apologize for that. So QMB Pluses and QMBs will not pay copays and cost share for both regular MAPD and dual MAPDs. So you don't have to put them in a dual plan if you don't want. If there's a regular MAPD that looks better with the ancillary benefits, you can put them in that regular MAPD and they won't pay copays. All levels have drug help and will coordinate with a PDP, MAPD, or dual. So full Medicaid or any of the Medicare Savings Program levels all have drug help. If the drug isn't in the plan formulary of the PDP or Advantage you enroll them in, the state will not help with the cost either. So that's really important. Keep in mind, remember, providers can't balance bill members with QMB Plus or QMB, even if the provider is opted out of Medicaid. And lastly, QMB Pluses and QMBs will not pay cost share with an out-of-network doctor on an HMO, MAPD, or an HMO dual. They will on a PPO plan. Full Medicaid people get extra benefits that QMB onlys don't. So a QMB only gets help on their copays, but they don't get extra stuff like vision and dental. A full Medicaid does. At times that can make it harder or a more difficult sale to enroll a full Medicaid into a dual plan, because they might say to you, well, I'm already getting dental and vision and transportation and all those things. A QMB only is not. So it's a huge selling point on a QMB. They might not be paying copays, but they're not getting those extra benefits that you can put them in the Advantage plan and give them. Don't get me wrong, a lot of people enroll full duals, happens all the time, because the full dual, maybe with state Medicaid, they can only go to a clinic, a dental clinic, but the dual plan has a much bigger dental network on their dental benefit. So a full dual might still find those plans attractive, but a QMB, that's a home run for them. And then lastly, just remember and know and use your special election periods. For anybody getting any kind of help, they've got a change. They can make one change per quarter for the first 3 quarters. Let's see if we got any questions. That's it. I know it's a confusing topic. I tried to lay it out the best I could. But again, I know it's a little tricky. Okay, question is, how do you find the state benchmark for your state? I almost think you just Google it. Google, let me think for a minute. You'd Google Medicare Part D benchmark premium in the state name, and it should come up pretty quickly. So that's what you would do. That's a good question, but that's how you'd find the benchmark premium for your state. So Medicare Part D benchmark premium, Michigan or Minnesota or whatever it may be. Do we have any other questions? Let's see if we got any more. We got that one. If you have any questions, please feel free to ask. I'm just waiting to see if we get any more here. It looks like that's it for questions. Certainly, if you've got any other questions in the meantime, just give us a call, email me, let us know. I'll be happy to answer them for you. Obviously, my contact information's there at the bottom. This webinar was recorded, so I recorded this. I'll send it out to everybody that registered. And then tomorrow, we're going to talk about our Discount RX program. Very similar to Good RX. The difference is you enroll people in this, they'll get paid for it, or you'll get paid for it rather, every time they fill a script. So that program's tomorrow. We're going to talk about that. We've had it rolled out for about a month now. Really popular and a great way to make extra money by offering discounts on drugs to your clients. Good replacement for Good RX. Well, thanks for joining me today. I really appreciate it. If you have any other questions, please feel free to ask, and I hope you have a great day. Thanks.